Good morning. The aims and objectives for this PowerPoint presentation involves my group members of Amanda, links between culture and Aboriginal and Torres Strait Islanders health, Christina, who is identifying the social determinants of health, Candice, applying the application to culturally safe nursing practice, and as well as Ingrid. The overview of the PowerPoint presentation will consist of healthcare context chosen for Section A is remote, and the healthcare need chosen for Section B is health promotion, and the health issue chosen for Section C is otitis media.
Hi, my name's Amanda and I will be talking to you today about links between culture and Aboriginal Torres Strait Islander health. Importance of culture, the statistics for otitis media in South Australia, health program in the Yalata community. Culture is important to Aboriginal and Torres Strait Islander communities in relation to health and well-being. Health is a holistic representation of well-being. Culture, along with social, emotional, and physical factors, contributes to the individual's and community's health and well-being experience. The service provided to the Aboriginal and Torres Strait Islander communities need to be aware of their cultural needs. The culture of Aboriginal and Torres Strait Islander is focused on family and relations and related to spirituality, identity, and well-being. The definition of kinship in Aboriginal and Torres Strait Islander communities is a complex system that is unlike the definition of the family unit in non-Aboriginal and Torres Strait Islander communities. The roles and responsibilities within the family unit within Aboriginal and Torres Strait Islander communities involve the extended family and community elders. The family unit within Aboriginal and Torres Strait Islander people provides support, strength, and protection to individuals and the family unit, but also provides an element of pressure due to the kinship responsibilities to provide support to the younger generation within the Aboriginal and Torres Strait Islander communities. Services provided to Aboriginal and Torres Strait Islander communities adhere to the cultural needs of the community, incorporating the kinship element to develop trusting relationships so that effective care can be delivered. Culture-aware services ensure improved health outcomes for Aboriginal and Torres Strait Islander communities, decreasing the gap within the provision of healthcare services. Cultural-aware healthcare services provide the Aboriginal and Torres Strait Islander communities to access service with Aboriginal and Torres Strait Islander workers. This provides a link for the Aboriginal and Torres Strait Islander communities to safely access services that are culturally safe and links the community with resources. Child and health services are provided with cultural needs in mind, which can provide the kinship with another element of strength and support. The 2011 census findings concluded that the total Aboriginal and Torres Strait Islander population in South Australia was 30,430, and around 50% of this population resided in the rural and remote communities. This included 3,379 Aboriginal and Torres Strait Islander children that were aged 0 to 4 years old, and 6,971 were aged 5 to 14 years old. The Aboriginal and Torres Strait Islander children that lived in the remote communities were less likely to pass an audiometric screening test. The pass percentage was as low as 33.7% in children aged 5 to 6 years old. The screening programs identified that Aboriginal and Torres Strait Islander children living in South Australian remote communities had ear and hearing problems. The remote community of Yalata implemented an ear health program that provided surveillance and monitoring of middle ear diseases, including otitis media. This program is funded by the Rural Health Division of the Department of Health and provides knowledge and education to the members of the program.
This slide will cover the healthcare context for Section A in Yalata community of the remote area. This information covers the Yalata community background, statistics, and the number of types of health services available. The Anangu people of Yalata share significant health problems with the majority of Aboriginal communities in Australia. Barriers of culture and remoteness have led to poor health service needs. Aboriginal people have established independently and incorporated the community-controlled health services in the early 1970s, which is shown in the bottom second left image. Yalata Maralinga Health Service Incorporation was established in 1982 following community initiative and lobbying. Anangu people lives on the traditional lands and remote communities practice traditional custom and the spiritual beliefs remain strong. Indigenous employment rates may vary from geography. In 2014 to 2015, about 31.1% of all Indigenous people of workforce aged 15 to 64 years in remote areas were employed compared to 57% of those living in the major cities. According to the available health services, the image on the bottom left corner depicts the location of Yalata and its available health services shown on the red arrow pointed. Tulawan Health Service is an Aboriginal health clinic. There are no hospitals within the area found. Tulawan Health Service is based at Yalata community, and it is approximately 200 kilometers west of Ceduna, 50 kilometers west of Nunju. The regional express flies twice daily to Ceduna from Adelaide and the 2-hour drive from there to Yalata. This slide will cover the healthcare need for Section B on health promotion for otitis media. Otitis media is a significant health issue mostly for Aboriginal and Torres Strait Islander children. About 90% of Aboriginal children in remote areas are diagnosed with otitis media. Otitis media is a disease that is also known as an ear infection. If the infection is left for too long period of time, it can lead to hearing impairment that can affect the children's speech, language, and learning, and as well as leading to behavioral problems that can affect on the social, emotional, educational development. Otitis media can also cause permanent hearing loss. Health promotion is significant for communities to be aware of the resource and information provided. It also impacts on individuals and communities that support the treatments in preventing and improving signs and symptoms of otitis media in Aboriginal and Torres Strait Islander children through primary healthcare settings. This slide covers the health issue for Section C, otitis media. The common ear disease for Aboriginal and Torres Strait Islander population is otitis media. Otitis media causes hearing loss. The disease also affects problems in education because they cannot hear and also problems in speaking properly. The risk factors for otitis media include homes that are too crowded, history of smoking, poor environment conditions, and hygiene. Indigenous people, most likely to be children and young adults, have higher rates of the disease and hearing impairments than other Australians. About 12% of Indigenous people in the year of 2012 to 2013 were reported for long-term hearing conditions. About 13% of males and by 12% of females are affected. Otitis media is reported for the same number of people who are located in non-remote areas and remote areas, with both the percentage of 12%. In 2015 to 2016, the Northern Territory Hearing Health Services found that Aboriginal and Torres Strait Islander children who received hearing services were commonly diagnosed with otitis media with effusion. Half of the children had some form of hearing loss of 49%, which has been improved since 2012 to 2013 with a rate of 53%. Hi, my name is Christina, and today I'll be talking about the social determinants of health for otitis media. I'll be mentioning the lack of transportation that involves great impact on otitis media, and the unavailability to access transportation. The Australian Indigenous Health Infonet 2016 states the importance of the social determinants of health to the Aboriginal and Torres Strait Islander people, who may not only include their cultural determinants for their connection to land, but also struggling to gain access to the majority of the health services, especially to those people diagnosed with otitis media. A lack of transportation options involve a great impact to the disease on otitis media. Issues regarding on transportation can be a higher rate of Aboriginal Torres Strait Islander people living in remote areas, and may not have the health services provided outside within the city areas. The impact on transportation for people diagnosed with otitis media is that the unavailability to access transportation is an imperative social determinant for getting treatment and protecting other people within the community from this disease. This is demonstrated through the factors contributing to the ear disease of Australian Indigenous Health Infonet 2016. This states the factors of increased risk of health issue, which reduce and improves the mortality rates of Aboriginal and Torres Strait Islander people who is affected and diagnosed with otitis media is imperative. In regards to the people in the remote health care with this disease are more common than the wider Australian population of the Australian Indigenous Health Infonet 2016. A barrier to access health services in remote areas are 54%, and people who live in a non-remote area is about 37%. Why? Because the health care services that are required are not located within the area, or that it is located too far. This is demonstrated in the Australian Government Department of the Prime Minister and Cabinet 2012-2013. The Australian Indigenous of HealthInfo.net 2016 stated that in 2008, the National Aboriginal and Torres Strait Islander Health Survey calculated 3.2% of males and 2.9% of females have the disease otitis media. Therefore, it is importantly essential to have access to transportation in Aboriginal and Torres Strait Islander community and within the remote health care in regards of otitis media.
Hello, my name is Candice. In the next slide, I'll be discussing the culturally competent and safe nursing and midwifery practice. In the past, mainstream health services were failing to meet the needs of Aboriginal people and Torres Strait Islander people. For many Aboriginal people, being in a hospital environment invokes memories of racism and mistreatment. Due to the history of mainstream services in their lives, many Aboriginal people have a lot of mistrust towards existing health services. Because of the stolen generations, many Aboriginal and Torres Strait Islander people don't trust non-Aboriginal nurses and they choose only to see a doctor when the condition has severely deteriorated. Early intervention is vital to offsetting the negative impact of disability for Aboriginal and Torres Strait Islander children. It is crucial when we engage and work with Aboriginal and Torres Strait Islander communities to begin the process of establishing trust within the community through open dialogue, cultural awareness and cultural respect. The Australian Government and non-government organisations are focusing on addressing the needs of Aboriginal and Torres Strait Islander people through the Close the Gap campaign. Closing the Gap is a government plan to reduce disadvantage among Aboriginal and Torres Strait Islander people. The Australian Government and non-government organisations' aim is to improve the life expectancy, child mortality, access to early childhood education, educational achievement and employment outcomes in Aboriginal and Torres Strait Islander community. As a registered nurse, how we think about health, whether that is our philosophy, our worldview, our framework, influence what we do as individuals in the workplace and how we deliver the service. It is crucial to develop a cultural awareness, cultural respect, cultural competency, and cultural safety in relation to Aboriginal and Torres Strait Islander community to influence the services we provide as registered nurse in remote community. Improving service access is important to addressing health disparities. It is important to understand that there are different issues applicable to urban, rural, remote, and very remote populations that should be considered when we deliver services as registered nurse. Making health services work for Aboriginal people will encourage Aboriginal and Torres Strait Islander people to seek assistance, help, and advice in relation to health problems associated with otitis media in children. Working as registered nurse in remote communities, the following solutions may be implemented to assist Aboriginal and Torres Strait Islander people to overcome the barriers. For example, working together with Aboriginal doctors, nurses, midwives and staff to provide care and service to Aboriginal and Torres Strait Islander people, providing a culturally safe environment and an element of familiarities. Next point, create an Aboriginal friendly feel by displaying Aboriginal artworks in clinic environment. Offer culturally appropriate alternatives, medical assessment by a health practitioner or registered nurse in the communities, outstations, homeland services. Develop Aboriginal patient awareness of medical conditions and disease, using clear, simple language and more pictures to deliver of critical health messages. Verify informed consent, provide more transparency in delivering of service. Offer culturally appropriate materials. Culturally appropriate material designed for Aboriginal people includes pamphlets, newsletter, videos. Provide education seminars in remote Aboriginal and Torres Strait Islander communities. Inform Aboriginal patients in their own language, working with Aboriginal and Torres Strait Islander health workers or elders in the community. Provide staff with culturally awareness training, training Aboriginal culture so we can deliver service that can offer respect and understanding. And finally, act culturally appropriate. Continuing on from the previous slide, the following is a training video supporting Aboriginal and Torres Strait Islander patients during their hospital stay.
Working with Aboriginal health workers in the Territory is just embedded in our practice. We have Aboriginal health workers in the hospital who assist us with day-to-day routine management of patients. And we also, when we do remote community work, we work with Aboriginal health workers again. So they're just very much part of our ordinary daily routine.
It's a big thing coming down to a hospital if you've never left your community. So we're called upon a lot in dealing with the patients.
Up on the list is Tani, Archie.
When they're in the hospital, then the liaison workers visit them on the wards and then liaise with doctors and nurses about cultural aspects that they might need to think about.
I'm here to see Natalie.
Yep, she's in bed number 9.
Thank you. And then you'll fly home after 5 days.
After 5 days.
After 5 days, after the stent, yeah. So you've done really well, Natalie. Because I remember you wanted to go home the first day you came here.
A lot of the staff here don't realise that some of these patients coming from their community is their first time leaving their community.
Yeah, I'm JP.
And they're coming to a big city, a big hospital, and they're seeing a lot of strange faces.
Okay.
And I see those patients coming with a lot of fear, shame, job. You know, they're very scared. They might have had an experience with a relative that might have been in the same hospital previously and they didn't return home. What I had to do was get Sue, one of the nurses, involved to talk to Ronald about the discharge process.
She'll go through the education pack with you and explain everything so you understand what to do from now on to really look after yourself.
This slide consists of the nursing practice. Becoming culturally competent is about building respectful relationships. It happens over time, by our connections with others and through our daily experiences with children and families in our local community. As a healthcare professional, if you fail to gain or lose the trust and respect of the Aboriginal and Torres Strait Islander people, families and communities that you assist and where you are positioned, then there is a high likelihood that they will avoid you and possibly the medical organization. Communities are compound, and it is about building bridges to serve your community the best you can. This slide identifies the Health Alliance. Yalata Anangu community benefits funding from Kakarara Wulurara Health Alliance to assist with much needed housing for health workers and visitors such as dentists and other healthcare professionals. KWHA organizes a monthly flight from Adelaide to transport health practitioners to each of the 3 communities for 2 days. The visiting specialists and allied health practitioners provide support to the primary healthcare teams on the ground. Health access is important in linking you with resources and organizations at an international, national, state, and regional level. Health is dependent with housing, employment, education, and law. This slide consists of the Nurse Code of Conduct. Principle 3, Cultural Practice and Respectful Relationships. 3.1, Aboriginal and/or Torres Strait Islander People's Health. Australia has always been culturally and linguistically diverse nation. Aboriginal and Torres Strait Islander people have inhabited and cared for the land as the first peoples of Australia for millennia, and their histories and cultures have uniquely shaped our nation. Understanding and acknowledging historic factors such as colonization and its impact on Aboriginal and Torres Strait Islander people's health helps informed care. In particular, Aboriginal and Torres Strait Islander peoples bear the burden of gross social, cultural and health inequity. In supporting the health of Aboriginal and/or Torres Strait Islander peoples, midwives must provide care that is holistic, free of bias and racism, challenges belief based upon assumption, and is culturally safe and respectful Aboriginal and/or Torres Strait Islander peoples. advocate for and act to facilitate access to quality and culturally safe health services for Aboriginal and Torres Strait Islanders, and recognises the importance of family, community, partnership and collaboration in the healthcare decision-making of Aboriginal and Torres Strait Islander peoples for both prevention strategies and care delivery. In conclusion, we have researched the Yalata community, which is a remote community in South Australia, regarding their ear health and the health promotion of having regular ear health checks. We have all come to the conclusion that we as nurses must respect their culture, their beliefs, and the community as a whole for the Aboriginal and Torres Strait Islander people to be able to trust in us and our skills to help prevent further ear health damage and any other medical issues that may arise. We have learned a great deal about dealing with the Aboriginal and Torres Strait Islander communities, which has given us all an insight to what we have to look forward to in the future of being great nurses. For this summary slide, I will announce myself and my group members' summary. For my own summary, I have written, what I know now is that it is really important as a nurse to gather and research the appropriate information on the chosen remote area or any other specific area being focused on prior to practicing my skills to provide a culturally competent and safe care. This will help transform my practice to improve the Aboriginal and Torres Strait Islanders' health in the future. Candice's summary is, making health services work for Aboriginal and Torres Strait Islander people will encourage Aboriginal and Torres Strait Islander people to seek assistance. As a registered nurse, we have a responsibility to demonstrate culturally competent and safe care in relation to Aboriginal and Torres Strait Islander community to influence the services we deliver. Improving service access and our understanding and awareness is important to addressing health inequities in Aboriginal and Torres Strait Islander people. Amanda's summary is what she knows now about the links between culture and Aboriginal health is that as a nurse, she needs to respect the culture and traditions of the Aboriginal and Torres Strait Islander people for them to be able to trust in her skills. Now that there is better links between healthcare resources and culture of the Aboriginal and Torres Strait Island communities, it makes it a little easier to treat them when medical issues like otitis media arise. Ingrid summary. We, the new generations of registered nurses, have the responsibility to educate ourselves to have a deeper and broader understanding about the importance of the future of healthcare, to be able to help assist the Aboriginal and Torres Strait Islander people in all their healthcare needs without burning bridges, but instead building a better and brighter future.